Welcome to Hospital 5280 Pre-Hospital Emergency Medical Services YouTube channel. Today we will be addressing ALTE, the acronym for Apparent Life-Threatening Event. The definition of an ALTE is stated as an infant less than 1 year of age with an episode frightening to the observer. For instance, mother or dad, family member, a babysitter, or a day caregiver, and they characterize by apnea, loss of consciousness, choking, gagging, color change, or change in muscle tone. In addition, ALTEs, or near-miss SIDS as previously termed, usually occur in infants under 12 months old. However, any child less than 2 years of age who exhibits any of the above symptoms should be considered an ALTE until proven otherwise. It is important to note that if the ALTE is frightening enough to generate a 911 call, resulting in an ambulance responding to the scene, then there is an expectation that the patient will be transported to the hospital for further assessment and observation. Often by the time emergency responders arrive on scene, the ALTE has resolved, making it extremely difficult for the emergency responders to assess the patient. In most cases, the infant or child will have a normal physical exam when assessed. The patient or parent or caregiver's perception that something is or was wrong must be taken seriously. Pre-hospital responders that are left with no obvious signs or symptoms of an illness or injury too often elect to leave the patient on scene. Emergency responders should take special note that 100% of patients that report an ALTE and who are less than 30 days of age be transported to the hospital. If the parent or guardian refuses medical care and/or transport, a consult with your base hospital physician is required with the completion of an AMA refusal care form. In order to help identify the infants and children that need further evaluation by a physician, it is important for emergency responders to understand the potential causes of an ALTE. However, 40 to 50% of ALTE cases can be attributed to an identifiable cause. However, it is nearly impossible for these causes to be identified in the field by emergency responders to identify all the causes. For example, NAT or child abuse, swallowing dysfunction, infections, bronchiolitis, seizures, CNS anomalies, cardiac disease, chronic respiratory disease, upper airway obstruction, metabolic disorders, and anemia. A thorough medical history exam needs to be documented, including the severity, nature, and duration of the ALTE. Was the child awake or sleeping at the time of the ALTE? What resuscitative measures were taken, if any? Known chronic diseases, evidence of seizure activity, current or recent infections, recent trauma, medication history, known gastroesophageal reflux or feeding difficulties, unusual sleeping or feeding patterns, vaccination status. And today's take-home message: check a blood glucose level, check a blood glucose level, check another glucose level.